Thanks for coming in. I'm Dr. Stotts. Nice to meet you.
Jane,
Nice to meet you. Where do you live?
here in Bend.
Awesome. Cool. How did you hear about us?
My mother comes here.
Awesome. Okay. So with the new patient limited exam, if you look at it, there's a bunch of scenarios on how the new patient is going to introduce themselves or how they heard about us. Okay. So for example, in this instance, how did you hear about us? And she said, my mother comes here. So in that instance, what you're going to say to the patient is, oh, awesome. How are we treating her? Meaning, we're going to treat you amazingly. Why? Because there would be no way that you're in here if we're not treating your mother amazingly. So we're kind of setting the stage that we're going to be treating this patient amazingly. Okay. The second scenario is she could have said that she heard about us because she saw the sign on the outside. Awesome. Okay. The sign says open and affordable dental. So I'm simply going to say, oh, awesome. You probably heard that we're here from 7:30 to 7:30, Monday through Saturday. So whenever you need us, we're here for you. Okay. So that's kind of the standard spiel. And it's very important to enunciate and also concentrate on the fact that we're here till 7:30 at night and we're also here till Saturday. Okay. The third option here could be they heard about us through their insurance company. So they're most likely a blue collar worker, and they occasionally switch jobs. Okay, and it's important for them to realize that we are in network for almost all insurance companies. So if you look at the verbiage on our signage, that's what it says, almost all insurance companies. So make sure that you say that. Okay. So we're in network for almost all insurance companies. So if you ever change insurance companies, we'll still be in network for you. So we just eliminate the stress that if we change insurance companies, they don't have to find another dentist. Okay. And then after that, we go into the normal portion, which is, so you might have heard we're here from 7:30 to 7:30, Monday through Saturday. So whenever you need us, we're here for you. Okay. Okay. The fourth option is I was going to another dentist. Okay. This is a perfect opportunity for you to get as much information from the patient as possible as to what the other dentist was doing that we could do better. So I would say, oh, okay. So what was your other dentist doing that we could do better? And then they're going to tell you a bunch of stuff that you are going to make sure that you don't repeat. Now, a lot of open and affordables flow and systems have been designed around our learning from what other dentist offices are doing or other for patient experiences and a lot of their feedback. So we have systems designed around avoiding all of those things. But this is the perfect time to get all of that information. Okay. So then we'll go into the standard dialogue, which is so we're here from 7:30 to 7:30, Monday through Saturday. So whenever you need us, we're here for you. I'm going to get you my cell phone number. So, and now the cell phone number that we're going to use is the after hours phone number right off of our website. Okay. So you can take a look at that. In this case, it's 720-580-1117. Okay. So I'm going to get you my cell phone number. If you ever have a question, night or day, don't hesitate to give me a call. And then if you do have a good experience with us, I would love to see your friends and family. I'll give them all free examinations if they want to come in. Okay. So the intonation of your words is super important. Okay. There's a difference between if you have a good experience, send in your friends and family versus if you have a good experience, I would love to see your friends and family. I'll give them all free examinations if they want to come in. The idea behind that is when open and affordable started, we had no patients at all. And, I would see 4 patients in an entire day. And I was literally begging patients to send in their friends and family so that I could be busier. Okay. So you need to have that drive and those connotation and words to make the patient understand that, first of all, we are taking new patients. Some patients don't think that we're taking new patients. Yes, we're absolutely taking new patients. And we're just building it into our dialogue to ask for patient referrals, okay? One portion on One of the other options here is the patient might have said that they saw us, they Googled us or found us on the internet. If that's the case, we want to go into the 7:30 to 7:30, but we also might want to ask, hey, did you happen to see our 5-star reviews? Meaning we're kind of setting the stage for this patient to give us a 5-star review at the end of the appointment, okay? Another concept here is sometimes I see doctors that have pre-written all of their phone numbers on business cards, and then when they come in here, they essentially just give the patient the card that has already been written on. And I always say this, okay, if you are a female, okay, and you are at a bar and a gentleman walks up to you and he pulls one out of 50 business cards out of his pocket that already has his phone number written, versus another gentleman who comes up and writes his phone number down and gives it to you, what is the chance that you're going to call the first gentleman versus the second gentleman? So be aware of that. You need to be writing this down right in front of the patient because they're going to feel special, okay? So I'll go ahead and write down their phone number. And I'll write down free exam plus x-ray, okay? And then I will give it to the patient, okay? So at this point is when we're going to ask the patient, so what's going on?
Toothache on the bottom right.
Okay, so really it doesn't matter a whole lot on what the patient says, because we are going to always order a panoramic x-ray, okay? So what we're going to do is we're going to break into the second part of the new patient limited exam, which is this, okay? And I'll say the words and then I'll explain why I'm saying those words, okay? So what I'd like to do is we're going to grab an x-ray that goes all the way around your head, okay? So why are we taking a panoramic x-ray instead of a bite wing or a PA? First of all, legal concerns. We need to be able to see their entire dentition, okay? Would you ever like a dentist that if you brought your mother in and she had a chip on number 9, they didn't take an x-ray, and then 2 weeks later she had an abscess on number 15 that they didn't get, okay? The other thing too is I can't count the number of times that I always wish for insurance purposes that I had a picture of the patient's entire dentition before I ever touched them, okay? I've had other instances where there was a foreign object underneath their gums that I saw on the pano. They got referred out, another doctor made them aware of it, and if I hadn't had that pano, they could have accused me of having that foreign object in there or causing that foreign object to be in their mouth. So we always take the panoramic x-ray, okay? And when I signal down the hallway to my assistants, if they're not around, I'll just go ahead and do this, which is the international sign for panoramic x-ray, okay? So what I'm going to say to the patient is, so we're going to take an x-ray, goes all the way around your head, and then we'll take a look under the covers to figure out what's going on. So what I'm saying is that me and the patient are going to look together to figure out what's going on. This isn't going to be a situation where the doctor is dictating what we're going to do. No, we're coming up with the game plan together, okay? Then what we'll do is we'll come up with our game plan together as far as what we both want to do, okay? So again, we're coming up with our game plan with the patient. I'm not telling the patient what we're going to do. The patient and I are going to decide together what we want to do. It's essentially like we're giving the patient a menu. Are we going to do the root canal? Are we going to do an extraction? As if we're in a restaurant. Are we going to order the steak or are we going to order the salad? It doesn't matter to me, but we're going to both decide. Now, if the patient wants to do a filling, but really we need a root canal, that's why we both have to decide together, because what the patient wants and what is clinically possible might not coincide. So we're going to come up with a game plan together, okay? So the fourth item is we're going to go over prices of that game plan. We're not going to be doing a $1,200 procedure and then the patient is surprised up at the front how much this procedure costs. The patient is going to know what we're doing and the price. And in fact, when we go over our options, if we're going to do a root canal or a fill or an extraction, the patient is going to make the decision with the doctor. Hey, I can't afford $600 for a root canal, and I won't be able to afford the $400 for the crown. So we're just going to have to do the $200 extraction. So it's very important that they know prices and that prices are built into the treatment plan. Okay, and then finally, the fifth item is we're going to say we're going to get you all fixed up. Why is that important? Because we've learned from patients that they go to a dentist office, the dentist office takes 1,000 x-rays, they never get anything done, and then they're rescheduled for the next couple of weeks. Does the patient really want to come back for $20,000 when they really only had a chip on number 9? So it's very important that we address the chief complaint. Okay, we want to make this appointment as short as possible. We want to get them out of the office as quickly as possible with their chief complaint addressed. Okay, think about all of their previous dental experiences where they were told they need all of this work and they got rescheduled and they had to sit in the office for 4 hours. In our instance, we're telling them what the prices are, we're addressing just their chief complaint, and then we are getting them scheduled back for hygiene. Okay, in fact, if patients want to have kind of like a comprehensive oral, they're like, hey, do you think you can look at some other teeth? I usually say, let's go ahead and get this one tooth fixed. We'll get you back with our hygienist, and then we'll do a full exam. We'll take some additional x-rays, and we'll get every single tooth looked at that point. Again, that also makes us, a little bit of money in that we're breaking up the panel from the bite wings, and so our insurance company isn't going to downcode that to an InfoMax. So let's just review what we're going to say after we are talking about our office. Okay, so what's going on? They explain to us, and then what I'll say is, so let's go ahead and take an X-ray. It goes all the way around your head. Okay, number 1. We'll take a look under the covers to figure out what's going on together. We'll come up with a game plan together as far as what we both want to do. We'll go over prices of that game plan, and then we'll get you all fixed up. Okay, so not memorize, but have it very ingrained in your head, this entire new patient flow, so that you can come in and make it sound completely natural. So at the end of this dialogue, I'm going to just tell the assistant, go ahead and get the pano. And then what I like to do is just a pat on the back of the patient's shoulder, which to me is an expression of empathy and kind of an emotional connection with the patient that says, hey, I'm here for you. I will take care of you. Let's get this figured out, and let's do it in a comfortable manner. So